shameful being.
Aside from the health concerns, the parasite's rise to national concern was also economically motivated. As mentioned earlier, economic growth had been a top priority for the Korean government since the 1960s. In 1966, Kava made a sharp criticism that Koreans are working to feed parasites, and that it would take all of US aid combined to compensate for the damage caused by the parasites that Koreans carry in their stomachs. Kava argued that the lost productivity due to various parasites amounted to 48 billion won a year when putting into monetary terms. Add to that the cost of treatment and other expenses, and the figure rise to 255 billion. In 1966, the total amount Korea's export reached $250 million. On the other hand, there was a more practical reason. It was the problem of miners who had been sent to Germany. In the 1960s, mines were in great demand in Germany. And the combination of Germans' need to solve this, labor shortage by using Korean miners, and Korea's interest in earning foreign currency through labor export led to a large-scale dispatch of Korean miners to Germany. However, after the dispatch, the miners' entry into the mines was not as smooth as expected, because they were infected with parasites. The high temperature and damp soil inside the mines made it ideal for parasite eggs to hatch and persist. Also, the miners' inability to go outside and relieve themselves inside the mines also contributed to the contamination of parasite eggs. Therefore, the management of parasite infection in the mine became a sensitive issue. However, it was discovered that 80% of the first 250 miners sent from Korea were infected with parasites. The Koreans were quarantined in the remote forest and banned from working in the mine until they were confirmed to be fully cured. There was a fear of being sent back to their home, and it was scary and humiliating to be isolated in a remote place as a parasite patient. Citing parasitic infections, the German government stopped the second batch of workers and asked the Korean government to conduct thorough screening beforehand. The local media ran articles with the headline, "We exported parasites," and it was a national embarrassment. This reminded Korea that parasitic infections were a national disgrace. From that point on, anyone whose tested results show parasite would lose a dispatch permit. During this process, the perception that parasitic infections is a shame spread among miners and applicants. Those who were forced to miss out on important life opportunities because of a trivial parasite must have felt even more shameful of deprivation of opportunity and parasitic infection. Korea's high rate of roundworm infection became a shameful record of backwardsness. And this became one more barrier to overcome on the road to becoming a developed country.
Parasite Prevention Act.
Parasites, as a being, were transformed from coexistent to shameful. The economic impact of parasitic infections also raised critical issues. As parasite became a problem in Korean society, the Korean Association for Parasite Eradication, KAPE, was founded in 1965 by a group of parasitologists. Symbolizing parasites were shamed and targeted for eradication. However, the organization's initial efforts were limited by the funding and technology. The biggest achievement of the CAPE was the enactment of the Parasite Prevention Act of 1966, which was made possible through active lobbying by CAPE. This law required school principals to test and treat students for parasitic infections at least twice a year. For a while after the law came into effect, there was confusion. It wasn't clear which organization was responsible for testing and treatment for schools. A number of organizations sprang up and jumped into the competition. Some organizations would take money for testing and not deliver the result, which led to a lack of trust in testing. CAPE also faced financial difficulties due to the competition, so the organization was in despair. In 1967, the entire management team was replaced, and in November of the same year, a formal request for assistance was made to Japan. At the time, CAPE's own funds were insufficient to provide national coverage, so it needed external funding and support, which required cooperation of the Japanese government. Japanese lawmakers had formed a medical cooperation committee and were discussing medical aid at the time. The Japanese government agreed to provide official assistance through its Overseas Technical Cooperation Agency, OTCA, which led to the official dispatch of a survey team in August 1968. The initial assistance plan was for 3 years, spending $57,750 in the first year, $54,500 in the second year, and $11,800 in the third year, to become a total of $125,000. The Japanese method, which emphasized economic self-reliance of mass screening and mass treatment, based on technical resources, was introduced and established. This became an important milestone that has characterized Korean parasitological work ever since. Until 1969, when school-based mass screening became profitable, CAPE used to operate on the basis of free testing and free deworming medication if worms were found for paying subscribers in the local area. However, due to the proliferation of healthcare organizations at the time, which often required membership fees, few people were able to pay all of their membership fees regularly. Furthermore, the membership-based operation was limited in expanding the number of members and was not profitable due to the budget required for free testing and medication. For these reasons, from the beginning of the partnership, Japanese officials have been urging their Korean counterparts to eliminate the membership fee system and adopt a self-sustaining organizational structure based on revenue from school mass screenings. Korea ended up adopting the same business model as Japan, collecting a small fee from schools and using it to cover operating costs. The difference between the two countries was that all fees were collected from parents in Japan, while the subsidies paid to schools by the Ministry of Education were paid back to CAPE in Korea. As a result, CAPE's work in Korea was subsidized by the state. In that sense, while Japan's work was largely private, Korea's work was a half-private movement that was institutionally and economically dependent on the state, although the actual operation was left to the private sector.